I would just like to welcome, as people join, I'll get started with just some early comments. But and as you join, just reminding people that if you have any trouble with technical issues or issues to do with understanding or working out what's going on, feel free to use the Q&A box chat to let us know. I'd like to start by introducing myself. I'm the CEO at the National Centre for Action on Child Sexual Abuse, and on behalf of the group who are talking with you today, I'd like to acknowledge respectfully and celebrate Aboriginal and Torres Strait Islander nations on the lands throughout Australia. From wherever you're coming from, I'm Wurundjeri land in Melbourne, Naarm, and pay our respects to ancestors of this country and elders past and present. We recognise that Aboriginal and Torres Strait Islander communities' culture and law have existed within Australia continuously for over 65,000 years. We acknowledge the ongoing leadership of Aboriginal and Torres Strait Islander communities across Australia, acknowledging that those who have passed and those who continue to work tirelessly to address inequalities and improve Aboriginal and Torres Strait Islander justice outcomes for children and young people. Further, the National Centre is committed to ensuring that the voices of those whose lives are affected by the decisions governments make should fundamentally inform those decisions. And in that light, we also seek to honour the lived and living expertise of all victims and survivors of child sexual abuse, harnessing all ages, cultures, abilities and backgrounds, and commit to substantially addressing the harm of child sexual abuse now and well into the future. We recognise that there are children and young people today who are experiencing child sexual abuse, and we dedicate ourselves to doing all we can to promote their effective protection and care. So welcome everybody to our webinar today. For those who don't know much about the National Centre, we were founded late in 2021, and it's a partnership between three leading organisations, the Australian Childhood Foundation, Blue Knot Foundation and the Healing Foundation. And the work of the National Centre focuses on commissioning and conducting research, building workforce capability, raising community awareness, and leading and collaborating for system change. And one of the ways that we seek to do this is to draw the knowledges of a range of different people so that we are getting a rich, vibrant conversation, noting that lived and living experience and cultural knowledges and research and theory and practice knowledge and procedural and policy knowledge are all important in bringing together the thinking, and that's what we're seeking to do today. So we have an awesome panel. We're recording this so you can watch it later, and welcome to those who are seeing it via the recording. And we would like just to remind people that some of these conversations can kick off feelings that you might want to seek support for, and there are some encouragement there and some lines that you can access to talk further if you need to. So thank you. And as I said, we are being recorded, and there is a Q&A, I was going to say quality, Q&A function, so that you are welcome to put questions in there. Of course, we have found with these webinars, we haven't always been able to answer everything. So I will do my best to draw questions to the panel. But I would really like to welcome this panel. It's an auspicious panel, and just delighted to have them here today. So let me tell you a bit about them. We are looking today, as you know, on insights from research and practice and lived experience on the drivers of child sexual abuse and how these can influence efforts for prevention. So firstly, let me welcome Professor Daryl Higgins, and you can see full bios on the website, but let me just talk to you a little bit about Daryl. He is a registered psychologist. He's the director of the Australian Catholic University's Institute of Child Protective Studies and former deputy director of research at the Australian Institute of Family Studies. He has extensive research experience spanning over 30 years in areas including child safe organisations, child abuse and neglect, child protection, and out-of-home care and family law. He's contributed a number of reports and provided expert advice to the Royal Commission into institutional responses to child sexual abuse. And he's one of the Australian Childhood Maltreatment Study team members. So, Daryl, welcome. Thank you so much for joining us today. It's wonderful to have you.
Thanks.
Let me introduce Christabel Chamarat, who's a registered clinical psychologist with over 50 years' experience in treatment of violence and sexual offending and healing for adult victims of child sexual abuse. She's a founding board member and clinical director of Safe Care in Western Australia. She's held roles as an expert consultant to the Ministry of Justice and member of the West Australian Parole Board and a member of the West Australian Board of Professional Standards, the Anglican Church. Christabel is a single expert witness appointed by the Family Court of Western Australia and is a postgraduate psychiatry lecturer on child sexual abuse. Christabel is a member of the Non-Government Advisory Committee for the National Office for Child Safety. So, Christabel, thank you so much for making time to join us today. It's wonderful to have you all the way from Perth. And Kel, who says that we shouldn't call her Kelly, we should call her Kel, is a victim and survivor of child sexual abuse. She is also an author, speaker, advocate, and a research fellow with the ALEX Lab, which stands for Artificial Intelligence for Law Enforcement and Community at Monash University. Kel's an expert in child protection and trauma-informed approaches, bringing a multidisciplinary approach to provide perspective, rigour and objectivity to the ALEX research project. The project is Survivor Perspectives on Institutional Use of Child Sexual Abuse Material, CSAM, which is a funded project by the National Centre, our National Centre for Action on Child Sexual Abuse. Kel also has more than 16 years of first response policing, and this, coupled with her lived experience, has enabled a very rare insight into the needs of victims and survivors throughout the investigative process. Kel, it's awesome to have you. Thank you for making the time and joining us. It's wonderful. So let me frame the conversation, which is about what we know and what that should tell us about prevention. But I'd actually like us to start with, do we genuinely believe that child sexual abuse is preventable? And Daryl, I'd go to you to get your thoughts about that. What's the definition of prevention and is it preventable?
Yeah, look, thanks, Leanne. It's a great question. And my fear, I think, if I listen to the conversation, and particularly if I hear, in the media how child sexual abuse is talked about as a problem, it's very easy to come away thinking that, in fact, we don't believe in prevention. I think even in the sector, we can be at risk of veering into, intervening after harm has already occurred, or once risk is really elevated and has escalated. Sometimes when people use the word prevention, and then they start talking about who do you go to, like particularly for children and young people, who do you go to if you have experienced something of concern? Well, that's after something has happened. It might be about preventing something worse happening, but it still is, about waiting until those problematic behaviours, whether they're from another adult or from another child or young person. And so I think from a prevention perspective, I always like to think about it from a public health perspective. And so we recognise that, there's a whole continuum there. But I think about prevention primarily in terms of primary prevention. So stopping something from happening in the first place. So if we think of other examples, COVID, we're actually wanting to stop getting infected. We're not about wanting to treat the symptoms or lessen its impact or any of those things. We're actually saying, what can we do to stop getting infected in the first place? So that's really what primary prevention is. Secondary prevention is more where there's, really high risks, so we've already got, based on research, we know that there's a particular subpopulation or a particular location, etc., where we might have to do some more intensive work. And then tertiary prevention is really that kind of healing. So it could be justice responses, it could be, psychological healing in order to stop the ongoing impacts of it. And yes, it's all prevention, but personally, my passion is really about, primary prevention. And until we start hearing, in the general conversation, and until we, start having researchers and advocates, including myself, talking about, primary prevention, I think we end up giving this message that sexual abuse is just something that we have to respond to after it's happened, and just, cross our fingers and hope that it won't happen. And that should not be the case. Mm.
And Daryl, before I go to Christabel, I just want to come back to the question, do you think it's preventable?
Yeah,
Is child sexual abuse preventable?
Yeah, I absolutely do. But of course, it's not one simple answer. There's
Sure.
a lot of different things that have to come together, and it does depend on which particular context we're talking about, who the harm might be from, as to how we might be able to think about it. And also, one of the lessons that we've learned from the Australian child maltreatment study is that sexual abuse doesn't always happen on its own.
Mm.
That in fact it can be happening alongside other aspects of child abuse and neglect, which in turn can place children at risk of child sexual abuse. So we have to think about it in the context of, other harms as well. Mm.
Thanks, Daryl. And just moving to you, Christabel, and your work at I guess, with adults who've experienced child sexual abuse and trauma. What's your thoughts about whether child sexual abuse is preventable?
I absolutely believe that it's preventable and that we can address it in our community. And my evidence comes from working for, as you said, 50 years with adult survivors of child sexual abuse, but mainly men, but also women. And also I have worked with children and young people as well. But what I've learned is that if we provide therapeutic intervention for all victims of childhood sexual abuse, we will be able to prevent child abuse from continuing to happen. But I
Mm.
think there's two things, and it's really good on this panel that Daryl is representing the primary prevention, because I'm actually representing the primary prevention of tertiary intervention. Because if child sexual abuse and domestic violence, as we know, is an intergenerational phenomenon and a cycle that keeps happening, then if you don't provide tertiary intervention and prevention and healing and restoration, you're actually part of failing the primary prevention of the next generation of victimization and offending behavior. So I'm totally committed to prevention. I believe it can happen. I'm sad that the treatment as prevention for all victims of childhood sexual abuse is not seen as primary, but is dismissed as the after effects. And not that Daryl dismissed it, I have to say, but in general, in our
Mm.
mindset, it
Mm.
gets dismissed as, oh, that's only tertiary, that's after it's happened. But in my experience, if we don't go upstream to find out why it happened in the first place, which almost inevitably goes back to childhood experiences of child sexual abuse or domestic violence, if we don't actually address that in the adults, then we are actually part of perpetuation and a failure to prevent the next generation of victimization and offending.
Christabel, thank you. I'm going to come back to you about that, but I'd love to hear Kelly's view, Kel's view on is child sexual abuse preventable, Kel?
The cynical side of me as an ex-police officer and a victim struggles, but from my work currently, I do believe there's every hope. And I say that because partly because of the research, partly because of the hat I wore as a police officer for so long. My kind of view is that for those who've already been in the system, who've been, victims and survivors who might be adults now currently, or offenders who are continuing to offend, I don't hold a lot of hope for rehabilitation for those who've already kind of stuck in those cycles, who are adults, right? I believe that they can be helped, and I believe that their behavior can be changed, but I don't know that it's going to stop it. My hope is that prevention is going to come by a consistent approach to consistency, right? Safeguarding consistently. But it has to be for longer than 5 years, right? We have these government promises that come in and it's 5 years and the money runs out. And these programs can't continue. And there's processes that people that don't talk to each other and systems that aren't talking to each other. So where there's inconsistencies in systems, where people are part of multiple systems, like the legal system, the child protection system, when these places are not talking to each other, there's gaps, right? So where there's systems that are not accountable and not responsive, we're going to have problems. But where we've got accountable and responsive systems, I believe that's a prevention measure, because as long as offenders know that systems are not working together and there's gaps, I think it's an opportunity for them to offend, right? So I think that accountable and responsive systems are a prevention measure, and there's a greater risk and therefore an opportunity for vulnerability within those systems. But where we can kind of seal that tight, offenders going to be looking at that going, oh, well, they're going to know about this if I do something wrong. But it has to be consistent. It has to be, we have to be targeting our young people from as soon as they can talk, as soon as they can be empowered to have conversations about what's happening and have autonomy around their body. And there's accountability for parents, there's accountability for systems and processes and governments. And, we have to be acting and not just going, oh, well, we understand. We have to be responsive. We can't just have trauma awareness. We have to have awareness and response. And when that's happening across the sector, where there's, we're not operating in those silos, we have to be talking to each other about people who are in our system, who are part of multiple systems, so that we're all on the same page, we're all working together for solutions that are going to work for that specific family or for that specific victim. Or I think we're missing the mark, right? I think we have to start, and we have to allow this to continue throughout a generation. And that means addressing pornification, addressing over-sexualization in our young people. It means addressing our online harms. It means everybody working together from the same approach to stop this from happening. So yes, I think prevention can happen for our next generation, but it's going to take, and I agree with both of our amazing speakers, it's going to take everybody working together, and a lot of things have to come together for this to work. And there definitely needs to be more accountability in our systems, because where there's ad hoc processes, survivors, and this is coming out of our research now, our early findings, survivors feel like they cannot trust systems, therefore they won't respond, and they're going to be sitting there in silence, holding on to their stories, holding on to their experiences, and not coming forward. And, that's going to perpetuate our mental health epidemic, our health epidemic generally. So we need people to feel like our systems are trusted and safe. And that's probably one of the biggest steps we need to take to start with.
It's extremely helpful. And I hope that out of our conversation, we might end up with a range of approaches to prevention, because I think one of the things, let me test this with the group, perhaps go to you, Daryl, that one of the things that sometimes I've noticed in the past is that prevention is about helping a child identify who they can talk to for safety. And you mentioned this earlier.
Yeah.
As if that's the only, that's an important prevention, very important prevention piece. But, there has to be multiple responses in multiple ways. So, and I'd come to you about what some of the others in your experience are preventative measures.
Yeah, thanks, Leanne. And I think it's a really good point to make, that it is important. And I don't want anyone listening to this to think that I don't believe in kind of protective skills for children and young people. Absolutely, it's important. But it shouldn't be the only focus or even the major focus. There has to be a whole lot of other stuff that we do. And one of the clear reasons for that is to think about how it is that sexual abuse occurs. And in many instances, not all, but in many instances, it's a process of grooming. So particularly where it's about adult to child, and we also have child to child sexual abuse as well, but where it's adult to child, the typical experience is about grooming, which is about building trust. So if in fact the focus of your education is about saying, who do you trust? Who could you go and talk to if you're feeling, unsure or icky about something? Well, that's what a perpetrator actually leans in on, to make themselves feel trusted, to make sure that the young person or the child, doesn't necessarily feel icky or isn't able to speak up despite the fact that they might have received education about this. So, we've got a number of things at play. But, to answer your question, Leanne, what are some of those other things? I think it's about creating capable guardians around children. And this is clearly one of the things that contextual prevention strategies focus on, is how we can build the skills and capabilities, whether it be of parents, whether it be of teachers and early childhood educators, health professionals who come in contact with children and young people, whether it's about the potential carers, for a young person in their lives, that they actually know about the importance of, those things that can actually prevent child sexual abuse from happening in the first place. And it goes to things like good knowledge and comfort about discussions about sex and sexuality. You don't even know that something is a problem, or in fact that you are able to speak up about it and that it's not your fault, if in fact adults haven't created those environments for children. And so that's not just about a teacher's job or someone coming in for 1 week a year to do a body safety class. That's everybody's job. So we have to have parents sitting around the table having conversations and not just laughing or smirking or telling children off, when they're inquisitive about sex and asking questions about sexuality, because they're not going to say for the first time, oh, I'm feeling a bit uncomfortable about something, when they're totally uncomfortable about the topic of sex because we as the adults around them have made them feel uncomfortable about this. And then there's other elements like consent, knowledge about what consent is, knowledge of what is normative and what people should be able to expect, around equity in relationships, gender equity, around respectful relationships. All of these things are important parts. And then I think to build on what Kel was talking about before, in particular contexts, be it online or be it in organisations, we actually have to have kind of safety by design. So those child safe organizational principles, which is both about, the physical spaces and the policies and the processes. We've had a lot of discussion recently around, online safety. But I think it all comes back to the core issue of, safety by design matched with building the capabilities of young people to actually navigate this environment. It's an environment, an online environment, just as we need to have the same kind of approaches for physical spaces, whether it be a classroom or a community or, we're part of a sports club and, we've got to get young people transported from A to B. What are our rules and our processes for dealing with privacy and dealing with, those opportunities? So it's really about opportunity. How is there an opportunity for somebody, be it an adult or be it another child or young person, to engage in a harmful behaviour or grooming behaviour towards that child or young person?
Yeah, thanks, Daryl. Really helpful. And if I just pick up one of those streams and go to Christabel, this idea, Christabel, about adults being uncomfortable about talking about sexuality and child sexual abuse, do you have any views about the challenges in the general community about this conversation?
Thanks, Leanne. It's a complex question and answer, I think, but I feel that most people in the community don't have a really good understanding of child sexual abuse and how it occurs. And certainly there is an ignorance about the fact that the Royal Commission into Institutional Child Sexual Abuse clearly established some of the validity of all the measures that have already been mentioned by Kel and Daryl. However, what was missed was the point that even the Royal Commission acknowledged that all the victims that appeared before them were only 6% of all child victims of sexual abuse, because 90% of child sexual abuse operates in the family, not in systems. So I think there's an argument to say there may be different measures for different aspects of the problem. And I deal mainly with families where child sexual abuse is an issue, and I deal with all family members. So I know that what Kel said about I think it was Kel said, survivors don't trust the system. Well, I think they don't trust the system because family members don't actually believe that the criminal justice system response, the accountability response, even the child protection response or the removal of children response and the creation of safety actually meets their needs at a deep level. Lots of them are deeply concerned because, as well as knowing that 90% of all childhood sexual abuse occurs within the family, and that 1 in 3 women has experienced childhood sexual abuse before the age of 18, and there's an unknown but guessed at figure for boys of 1 in 5, but I'm sure it's more, that we actually aren't addressing the interventions that families are calling for, where they want help for their adolescent boys, because what we also know is that 30 to 60% of children experience their first abuse from adolescent boys mainly, but also girls within their family system. We don't call it offending, we call it harmful sexual behaviour, which most of those boys have learned through experiencing abuse themselves or exposure to inappropriate behaviour. So if we don't actually look at the family system in a different way, I believe we will continue to fail to prevent child sexual abuse happening. The systemic abuses are probably and possibly much better addressed in the way that we've already described. But there's a huge gaping hole in the terms of what is it that families need to help them to be key agents in protecting their children and keeping their children safe. And how do they actually help and support the offenders who are offenders, adults, from reoffending within their family unit when they know that prison, in fact, does not work. If we don't have treatment services within prisons and we don't have treatment services within the community, we are actually, I believe, sorely neglecting one aspect of childhood sexual abuse that we could prevent and we could change. But there are no resources put towards it. And I'll just close with my little slogan. We hear a lot about evidence-based practice, and that's a key word. What we don't hear much about is practice-informed research. And sadly, the whole area of researching what works within families where childhood sexual abuse has occurred, what works for adult survivors, both male and female, and we know that there's a gendered dimension to this problem, where most of those who go on to offend are male, and those who go on to be repeat victims are female. Okay, have I got 1 minute more? I just want to say where I got this information from.
Yeah, no, go on, please.
Okay, I just want to say I worked for, when I was 23, I began working in the prison system, and for 5 years I worked with men in high security who'd committed violence and dangerous offending, and I found that almost 90% of them had experienced childhood abuse, trauma, and exposure to neglect and violence. The next 5 years, because I worked 10 years overall, I worked with child sexual offenders. And what I found to my shock was they didn't realize that they'd been abused in childhood, which made them at risk of actually repeating what had happened to them. And so my treatment base comes from a very practical area, not a well-researched area, though there is research to back it up, but it's very neglected and it's not focused on in policy making or funding or resourcing.
No, Christabel, thank you. And we have been reminded in the chat that not all people who have experienced child sexual abuse do go on to perpetrate child sexual abuse. But I'm going to come back to you, Christabel, about your call for more resources in that space. But Kelly, what is your research finding about family-based child sexual abuse? Is that where your research is focused? You're on mute.
Yeah, sorry, I was trying to get it off there. Yeah, look, not so much, but I mean, my personal experience is I was sexually abused by my uncle. So I'm very familiar with the grooming, and there's a couple of things I want to say, but also just to refer back to your question about the research.
Yes.
so my research is on the survivors' perspectives on how institutions use child sexual abuse materials. So
Right.
we only have early findings as yet, but what really is being shown, and our participants are mostly, particularly the ones that spoke to me, so I'm only going to refer to our interview participants. It's really coming from an organizational abuse perspective, right? So this is people who've been trafficked, who've been involved in what we'd call pedophile rings and those types of things, right? So often the cause or the start of this offending has happened by a family member. So this family member has been sexually abusing that person, and then that person has then been trafficked out, or other offenders have had access to that child, which then has obviously been filmed and those types of things. So the destructive nature of familial abuse is horrific. And I'm so glad Christabel said that, because if you didn't, I was going to. So thank you for that. And also Daryl, because I was going to mention about the Royal Commission and the fact that, we've got 9%, institution roughly, but 89% is perpetrated by somebody known. And we have a real body of work to do around this grooming. Now, I was groomed, and as an adult person who didn't really get help till much later in life, I know myself, and through my own lived experience, the vulnerabilities that I've had in just even standing up for myself, being able to say no, having relationships where I've been, I'm a big tough, like, ex-police officer. Like, you'd think I'd be able to, learn a few things, right? Not to say that all my partnerships were not good. I mean, I've had some great relationships, amazing people in my life, but there's also been some real vulnerabilities and red flags that I've completely missed as a result of my experiences. Had I known otherwise, that may not have been the case. And we know there's a direct link between, child sexual abuse and then also domestic and family violence. And as somebody who's been groomed, that grooming behavior and that gaslighting that an offender does to allow that abuse to continue is the same kind of tactics and emotional abusive tactics that they use, which is also then used in these adult coercively controlling relationships. So there's a real nexus there. And so adults or children without intervention and support become adults without intervention and support. They end up vulnerable and in these relationships, right? So it's there has to be some understanding around this grooming, right? And it has to start really early. And the problem is it's so complex that I think people just make the decision that it's too hard, and it's not conscious. I don't think it's a conscious decision. I think that families genuinely want to know, but then as soon as they start to hear about it, like, I don't want to know. I don't want to think that somebody in my family could possibly do anything like, not my family. No, would never be Uncle John, Uncle Bob, Uncle Smith, whatever. Would never be them. They're amazing, right? Well, we know that perpetrators hide behind good character. They hide behind good jobs. They hide behind, roles that put them in positions of authority. And, they're court workers, they're police, they're doctors, they're lawyers, they have jobs. Our offenders don't have a demographic. And I think that people are still stuck in a way of thinking that an offender has a certain set of glasses and a trench coat. Like, it doesn't work like that. Yeah. These people exist in our families, and young people without intervention become peer abusers. Like, there's a part of sexual I can't even remember the word, sorry, but when children experiment, they show their body, so it's normal, healthy sexual functioning with children. But where that becomes harmful, and then there's no intervention or support around those behaviors, that then becomes a young person who's got a problem, and it's not their fault, it's our freaking fault. It's our fault for not standing in the gap and being really strong and being really accountable. Because I don't think we have a problem with prevention. I actually think we have a problem with implementation. We know things, like we know stuff. We've learned stuff. We've asked questions. When I first started this, I've only just become a researcher, and I was so devastated when I read all this amazing work. I was like, we already know this stuff. Why isn't it happening? I got so upset. And I was just like, man, why are we even doing, sorry to my team, but why are we even doing this? Like, it's just here, right? So why are we not implementing this stuff? Because our kids are suffering while we're twiddling our bloody thumbs.
Why, Kel? Why are we not implementing it? What's your view?
Because I think we all, do you want my real view? I can't get
I do.
Controversial.
Bring it on.
I think it's a power trip. I honestly believe people are power tripping. I think it's about control, and I think it's about systems wanting to one-up each other. I think it's about, well, we're going to do it this way, and then they're going to do it that way. And sorry, you can't have that information. Where it matters about a young person, I don't think those things should be a factor. You know, when a governments want to be like, oh, we're going to do this policy and we're going to do that policy. And I don't know anything about politics, sorry, but I'm just like, what I see as a survivor is you guys know stuff, but you're not doing stuff to help me. And I don't understand why, when it's so clear. I feel like we're trying to overcomplicate shit that doesn't need to be overcomplicated. And it's making our children suffer. Our children are being left in harm when they don't need to be left in harm, because we're too busy arguing over who's going to do what.
Yeah.
In the police, I do a job, and then it'll be like, oh, that's not our responsibility, that's their responsibility. And then there's no follow-up, and then all of a sudden this child or this family is falling through the gap because nobody wants to take accountability for that action.
Yeah.
So we're just competing. We're competing for funding. We're competing for, like, you know, who's going to do what. We're, you know, talk to each other. Stop this bloody bullshit, because in the meantime, while we're having this conversation, a child is being hurt, a family needs help, and we're still arguing about who's going to do it.
Kelly, thank you so much. And can I just thank you for sharing your experience as well. It's just very humbling to hear it. Thank you so much. Daryl, I think you were going to jump in.
Yeah, so I'm not sure about whether it's power tripping, but it's absolutely lack of coordination at the at government levels, because we don't have a single entity that's responsible for the kinds of actions that we need to have happening here. Because some of them need to happen in the health sector, some of them need to happen in the early childhood sector, some in the schools and broader education. Parents and parenting. Which department's got responsibility for that? No one. There's a whole lot of departments that have touch points with parents and parenting, but no one that actually has got a directed, kind of strategy to build the capability of parents. So firstly, I think you've got to have evidence-based parenting supports and programs to enable parents to even have the capability to start having these conversations then around sex and sexuality and grooming and respect and consent and so forth. So these things all kind of intersect. Wouldn't it be great if we had a cabinet level minister responsible for children whose job it was to coordinate across these different tiers of government? So that's what I'm calling for. We also have to have a prevention-oriented movement where we need to have dedicated funding within all of these different sectors to take responsibility for implementing what they can within their sector. And to me, that would get rid of the power tripping and the kind of blame shifting that we end up having. Oh, well, that's not my responsibility.
Yeah.
Well, I don't care if you know about it. Have you not got the phone number of the deputy secretary of the other department that does have responsibility? And couldn't you talk with them and work it out of whose budget or how are you going to do it? Someone might be able to say, well, I'll pay for the people. I'll pay for the, the spaces, that you might need to operate in, or I'll pay for the training or whatever. Golly, it's where we should all be in this together.
Yeah, thank you. And thank you sorry, Kelly, I just wanted to say that, the National Centre's got a very strong view that the rights of children sometimes get lost and the voices of children get lost. And, picking up on your point about having a children's minister, that's a kind of governance example of trying to bring children up into the space and their rights into the space. Kel, I didn't mean to cut you off.
No, it's okay. I get called popcorn brain for a reason by my followers, and it's just it's because I can't help myself. I'm sorry, Christabel. But yeah, the thing I recognize, and it's coming out like a little bit through the research, but just some of the work that I'm doing and talking to Queensland Health and working with police and stuff like that is when we can't just put a cap on the pipe and hope that the pipe is going to be fixed, right? There's all these cracks and there's all these leaks along in the system, and we have to slow things down enough so that we're not, so you mentioned it in the beginning that we're so reactive, Daryl, like we just are so, and that's a police. So growing up 16 years in the police, right? So all we did was band-aid. We don't have time to look at the why, right? But within presentations, like when we can work together, I can see some beautiful magic happening, right? Because when we can look at presentations. So when a child first comes into the school and they start to disclose, and they make a disclosure and child safety becomes aware of it, but not much happens because it doesn't meet the threshold, and then they make a report into like the school system, and the school guidance officer or the school nurse becomes aware of something, but maybe it's not that much, but maybe it's just a picture, and then the next thing is a kid goes to hospital and they've got a kidney infection or some sort of thrush or something that's presented, but they're like, oh, we'll just treat it with some antibiotics. Meanwhile, there's 4 presentations already where bystanders have just capped this off as a response and given medication, where we need better ways to screen and ask questions, not just respond. So the part of the Queensland Health presentation I did, it was very much an awareness session, but it was like the whole theme was, what's the next question? So instead of just putting the Band-Aid on, ask them, why do you need the Band-Aid? Like, start asking a bit more and finding out, and then being accountable to asking those questions and those screening, because children are coming into our services, adults are coming into our services asking questions, and we're just answering, but we're not asking why they're asking the questions. Why does a 15-year-old need pregnancy advice, right? Why does a young person have multiple thrush presentations at a hospital or a medical clinic or a GP? And so instead of just dealing with the issues, we need to start asking why the issues are presenting. And when we start to have these conversations together, we go, oh, there's sexual abuse in the home. Okay, so where's the evidence? Yes, I know we need evidence. But when we can start to ask the child and empower the child to have that conversations, and we might actually get an answer.
Yeah.
Thank
you, Kel. And I'd just like to go to Christabel and pick up a point that's been raised in the Q&A in the chat, and encourage people to keep asking questions, because we've got these awesome panel for another 45 minutes. Christabel, can I go to you? How as a society do we stop pointing blame and being reactive and support parents with their own trauma histories? How do we do that as a society?
Well, it's I think it's the very step we have to take to actually stop putting a blame-oriented focus on the problem of child sexual abuse. I think what we need to acknowledge is that there's a pattern that occurs in families that are at risk, and that we need to intervene in the most effective ways possible. Now, of course, accountability is important. Of course, knowledge is important. But I actually think we're neglecting supporting and resourcing the family-based strength that can actually keep children safe, so that families can actually have an idea of what normal childhood sexual development is, and how something that their child is displaying is actually a little red flag. They need to have an idea of what's happening in their own family, when the very common pattern of a teenage boy who's struggling with his peers is left to babysit younger kids who are into the sexual exploration stage of their primary school years, and where harmful sexual behaviours arise. We need to be educating the whole community in a respectful, compassionate way to look at families that are struggling with these issues. But Leanne, I would like to respond to 2 things in the chat. One is, I totally acknowledge that only very few people who've been victims of childhood sexual abuse go on to actually offend. However, if you work with the people that offend, what you find is that so many of them have had that trifecta of abuse in childhood, of child sexual abuse or exposure to violence, or the most damaging one is neglect. Those 3 factors are present in almost 100% of those people who actually then go on to offend. And so that tiny proportion, there have been different figures about it, about 8% or 1 in 12, and it's gendered. It's mainly men rather than women. And there is a gender issue as well, which I'd like to point out, which is that if somebody is abused by the opposite sex gender, they're more at risk of being a repeat victim. If they're abused by somebody of the same gender that they identify with, they're more at risk of repeating that behaviour, particularly if they didn't realise at the time that it was awful and traumatic. And so it's a complex issue, but there are things we can understand. And I don't believe that we've done enough research or explanation of those causative individual factors that make people skilled at grooming or make people stuck in a childhood paedophilic attraction stage in their life. Now, I've got a question too. Oh, and I wanted to thank the person who pointed out that those who offend against children do also offend against adults. There is crossover offending which occurs. But what I want to ask everybody to think about is, what do you do if somebody comes to you and says, because this is what happened to us 40 years ago, I need help, I am at risk to children and I want help. Where can I get that help? And I got a phone call in 1989 from the head of the Child Protection Unit saying, Christabel, is it true that if somebody asks for help with the potential of offending against a child, there's nowhere for them to go? And in 1989, there was nowhere for them to go. I said, no, there's only a handful of us who work in this area. And even if they go to prison, there's nothing available in prison. So we are actually ignoring the cries of people who know that they're at risk and don't want to be at risk, and we're failing to provide support for them and their families to prevent them from doing it. It's just, it may be, I really don't want to, I'm not criticizing anything that's already been said. All I want is for this little jigsaw puzzle piece to be put into the big jigsaw and the overall big picture to say, why are we so ignoring it? When in my experience, I've seen thousands of sexual offenders and families and very, very small amounts of recidivism and reoffending, tiny amounts. And people will say to me, oh, well, you've probably been treating people who weren't going to reoffend anyway. That's a legitimate argument. However, there is a neglect of this area. And so I'd like everybody to be challenged to what would you do if somebody came to you?
Yeah.
What happened when somebody came to us in 1989 was that there was a state child abuse task force, and they gave 30,000 to set up a community-based helpline and treatment service for those who put up their hand and said, I'm at risk to my children. And in that first year, in 1989, 80 men put up their hands, said they were at risk, came into a treatment program, and 60% of them were unknown to any statutory authority. And that program continued for 20 years, providing treatment until it became politically unfashionable and difficult to argue. Because people wanted punishment in the law and order domain rather than providing treatment for people who are already asking for help. And I think that applies to victims who definitely don't go on to offend, but who do go on to be at risk of repeating their own victimization issues because they don't get enough support either. So I guess that's what I'm on to say.
Yeah, thank you, Christabel. And we just say at the National Centre that there isn't a pie that has to be, well, people have an idea there's a pie, and so we can only divide the pie up a bit to perpetrators and the support systems that you're talking about in healing, and a bit to victims and survivors of different age groups, and something else to prevention. We have to grow the pie, and we have to flip it on its head and focus it on the safety of children and the need to prevent child sexual abuse of children. And noting Kelly's the themes that she's raised around the leaking pipes, where the systems are in place, but they're not working, they're not accountable, and people are not sharing information. And so we allow, for example, privacy issues to be more important than a child safety. So, and that's a real challenge. Go on, Kel.
No, I'm totally just in agreement with you too. And it's just, there's a lot of time being taken up between organizations to get even police, for example, that have to act warrants and things like that in order to, they hear information, they want to stop something happening then and there and have to get a warrant, and, just things that take time, and the legal process, it takes time for a victim. I was subpoenaed back to court for something to give evidence for something from 2013, and this is a child sexual abuse matter. I was just like, what in the God's name is happening? How can any child who was a victim as a child and who's now going to be an adult be still going through court for 13 years? The stress and the trauma that victim has now gone through. Like there has to be, I would love to see a specialized sexual violence court with trauma-informed like judges, trauma-informed legal counsel, like systems that support victims who need and want to share their experiences and their stories, that need to be heard, that need to be validated. Because whilst there is a legal system that is not in support of victims and survivors, why the freaking hell would you bother to come forward? Because it's more traumatic. I would rather be sexually abused than go to court. I'm sorry.
Yeah. And
That's
it's not just criminal matters, it's also family law matters that need to be held by a court like that. You know, they've got a single jurisdiction.
Yeah. Can I just add something really quick? I just want to disclaimer on my statement. I'd rather be sexually abused than go to court. I've heard that from multiple victims and survivors. This is not just me spruiking off at the mouth saying something that I believe. I've heard this from, I have over 400 victims and survivors I support online. And this is something I've heard collectively. So this is a collective voice. It's like, I would not come forward. I'd rather be unsafe, or I just would rather take my chances with the perpetrator than come forward. We have to change that.
We have to change that, Kelly. We have to change it. Daryl.
Yeah, I was just, as Christabel was talking before, and she was using that analogy of a jigsaw puzzle, that just really resonated with me, because I think we can all visualize, you know, sometimes jigsaws might be, you know, 5 or 6 pieces. Sometimes it's 1,000-piece jigsaw puzzle. And sometimes some of us approach something by, well, I go for all the edge pieces first and then try and fill it in. Sometimes we start in the middle with something that's all the same color. And I think that that's all okay, that we will have different areas of focus. But in fact, we all need to work together on this approach to prevention of child sexual abuse, because it is complicated and it does go to so many different systems and so many different processes. And just to come back to a comment that was actually made in the chat, Marie Stewart, the very first comment was about the issue of grooming and how we actually have to kind of scaffold our learning, including from the early childhood sector. And I know that that's the sector that Marie works in, and I'm familiar with the curriculum that she's been developing that's now freely available. And so, Marie, this is a cue to you to put it in the chat for others to see, you know, that we actually have to not wait until the teenage years to be starting to talk about what grooming might mean and how we might be able to interrupt that. We actually have to start it, you know, in the early years, but in a way that's age appropriate, and to build on that conceptually and contextually as children develop and grow.
Thanks, Daryl.
I just think one thing too with the grooming while we're here, I think we need to make this matter. See, I believe the problem is that parents, education, I just don't like, I don't even think people really understand what trafficking is and how much is actually occurring in this country, right? We overlook things because we either don't want to know, or, you know, I know there's a lot to do, and I know that everyone's worn out, and I know the system is tired and strained, but we have accountability to our children and the next generation. We have to be able to support them to grow and to lead this country, or, you know, globally. But I guess the problem is, I feel like I've run programs before and I've had only parents that are already invested, right? Then they're not the ones I'm worried about. It's the ones that don't care and they're not coming forward and they're not turning up for education. We need to make this matter to the people that need to hear it, if that makes sense, like to our, you know, low socioeconomic families. I mean, it can be any family, but those who potentially might need more parenting support, or I don't really know how to phrase this, but the people that need to hear it are the people that are not hearing it. And we somehow need to get that message translation to them in order to make it matter, so that they become invested in learning about these issues, I guess.
And you know, I think I did an interview this morning at ABC Radio in relation to a new book that's been launched today, which is a children's storybook for multicultural communities about consent and about feeling uncomfortable and speaking up. And one of the things that I think, and so people should go and have a look at that. It's linked with the National Office for Child Safety. It's been launched today by the Attorney General. I think that one of the challenges, I guess, Kel, in some of this is like, where do we start with parents, and how do we build it into a system? So looking, coming to you, Daryl, on the sort of system level interventions, you know, where would we start with trying to reach those parents more broadly. And what is it that they need to know? What do we need to tell them?
Mm. Yeah, look, it's a big question. It's a great question. I think there's a number of different elements to it. Some of it is, the system level stuff around how we can actually drive change so that we get a focus on building capable parents. So, I think, as I said before, the highest level system change is we actually need to have a cabinet level minister who's responsible for children and childhood, so that they can play this coordinating role. Then secondly, there actually has to be that next level down of how to, at the Commonwealth level, and then at the state, and then at the local government level, how do we get a coordinated strategy? Now, I know, and I'm pleased that we have a National Office of Child Safety with a national strategy for preventing and responding to child sexual abuse, but we need to actually have greater kind of sign up and accountability to actions under that at all levels of government. And we need a minister, a cabinet level minister who's actually going to drive that for us to actually really see change get embedded. But as I said before, I think that working with parents to try and build their understanding of their role in being a capable guardian, keeping children safe, and responding at the earliest sign that there might be a sense of discomfort, noting, of course, that not all the time is there a sense of discomfort, but, that they will have open conversations with children so that they will be hearing around where there might be causes of concern. That takes multiple work. And I think it's not the responsibility of any one system. It's actually all of the systems, because the question that I always ask is, do you come in contact with families, with parents? And of course, Leanne, as you know, we were at the Early Childhood Australia conference last week, so that's a great sector where they're coming in contact with parents, often on a daily basis. So, that's one of the places. But, it starts right from birth. It starts in the maternal and child health service, or whatever it's called in your state and territory. Of course, we don't have consistency across even what we call it, let alone what they do. So how are we building the capability of nurses? How are we building the capability of early childhood educators, of teachers and other school staff to be able to engage with parents, to have conversations, to be able to ask the right questions of children and young people, but also have a framework in their mind so that it's not, oh, is there something here that I have to, as a mandatory reporter, tell a child protection department? That's a little too late. We actually want mandatory support, not mandatory report. So the mandatory support is as soon as there's some, thinking of, is there something more that I can be doing here, that people have actually got a framework that they can do in their particular organization, that's consistent with their kind of practice frameworks. And so that might mean we have to change those practice frameworks, so schools, can easily fall into that, well, I'm about, NAPLAN scores and reading and writing and arithmetic. Well, I'm sorry, but children actually don't learn very well if they're being abused and neglected at home. So it is your responsibility. You will actually get better results if, in fact, we do see this as part of our role. But on the other hand, I say, well, there's a whole sector out there called the child and family welfare sector, where we like to have, our brass plaques on the wall and say, troubled families come to us. Well, why don't we bring our skill set into where those families already are? So are we actually, playing a mentoring role at our local school or at our local early childhood centre?
Sporting club or whatever.
Yeah, exactly. And that's tricky and complicated work, whereas the practice models that we might be used to relying on, are easier ones to kind of adopt, because they're, it's more of the same.
The National Centre's got some good resources online around this and what parents can do. And I did have occasion to have another look at that. And, that one of the things, back to you, Kelly, about, how do we provide parents from all different backgrounds with more support? I think the workers that come into contact with parents, as Daryl's talking about, are critical enablers, important enablers. But, what do they need to know? They need to get curious about what's going on in children's lives. They need to let children know that you notice what's going on, that you look out for signs of harm and grooming, and such as becoming secretive or avoiding certain places or people. These are things that parents need to be alert to and need to be supported by, by the system to learn right from the beginning.
I was just going to add with Daryl's comment and what you're saying too, Leanne, is that people are less inclined to come forward if they know the infrastructure is not there to support them. So it's the same, like I'm talking like, police mental health. I've left the police due to, some PTSD and things like that. But many people won't speak about their mental health in an organization where there's already a culture, right? And they won't come forward because they don't believe they're going to get the help that they need, right? The same as I won't report my sexual abuse to the police because I don't think that I'm going to get a conviction, and why should I put myself through that? And so I know then the infrastructure is not going to be there because I've done my research, I've already checked online, I've done all the stuff, and I've listened to all the other survivors I'm talking to, and they didn't have good experiences. So why should I try that? That's just going to hurt me more. So when we are campaigning and we're talking and we're saying this stuff and we're making promises to a survivor who's already had their advocacy and their agency and everything stripped away from them, their trust, everything is corroded. We go and tell them we're going to help, and then we do shit and we throw them back into a system that doesn't work. So why would you come forward? We have to we have to build more relationships with our families and survivors who are struggling. We have to rebuild trust. We have to repair systemic harm, right? So it's like repairing a marriage. We have to do this part in the middle. There's a translation piece. This has come out in the research that I'm just doing, but I know as a survivor myself and the people I'm talking with, it's all the same. There's a real hurt and a heart to speak, and there's a real hurt and a heart to speak for systems that want to support. But when the system doesn't support the workers and it doesn't support the survivors, we need to change the system, because people genuinely want to help. People genuinely care. People who do these jobs. I don't know about you guys, but I beat my head against the wall daily trying to, do things because the system doesn't quite tailor or doesn't quite work for the survivors that I'm working with. Yes. And so we have to change the way that we tailor the system to support these vulnerable families.
Thank you, Kel. What do you think? You're nodding a lot, Christabel. I feel like you've got lots to add to what Kel's just said about changing the system.
Oh, I couldn't agree more. I think the system needs changing. I've just been jotting down all the things I've agreed with that Daryl and Kel have said. And I really like that mandatory support, not mandatory report, and having somewhere for troubled families to actually go for help. And the one thing that may not have been mentioned is parents, when they're being helped to be good parents, need to have an awareness that what happened to them in their childhood impacted on them. So they need that kind of public health approach and a therapeutic approach that helps them to understand what would a normal childhood be like. And of course, nobody's had a normal childhood. We've all had trauma, but it's having real capability building to actually say, what do I do when there's trouble in my family? Who do I go to? Who provides effective help? And I have to say, having been in politics, Daryl, I'm a little bit cynical about the cabinet minister appointment solving the problem, because it's a bit like climate change. If the community doesn't believe that we've got something to do, then a cabinet minister won't be appointed, or even if they are, they might not be able to achieve what we're hoping for. But I agree with the sentiments behind it. I'm just not, and I wouldn't mind if a cabinet minister was appointed, because I'd go and knock on their door, and so would we all, I'm sure. But I actually think what I've valued about the conversation is it has kind of morphed into how do we support better families within our community to protect their children from the risks that those children face at different points in their life. And from my point of view, because I'm coming from the point of view of working with people who have harmed, I actually know that there's this intergenerational being harmed, harming pattern that needs to be intervened into and help brought. And I don't think punishment and criminal justice system responses, while they are appropriate in certain cases, deliver the healing and the transformation that families are calling for. Families are actually wanting you to help rather than to punish. They may want punishment because they think that's all they can get or that they'll feel better. But I know people who've said, I was told if I talked about it, I'd feel better. I didn't. I was told if I charged the person, I'd feel better, and I didn't. I was told if I got compensation, I'd feel better, and I didn't. And I think we need to have support and help within the community in a more coherent way. And I think we're getting there. I really have enjoyed this conversation.
Thanks, Christabel. I wonder, Kelly, what you make of the just staying with the idea of families, parents, the equipping of people who are, my team knows that I often use a metaphor, an anecdote around, what happens when you're in aisle 5 at Aldi and there's a harassed parent with a tantruming child, and the parent who is struggling with the situation is being more aggressive than you would be comfortable with. Do you walk up to them and say, because they own that child, right, and they're responsible for that child, do you interrupt that cycle of what is potentially abuse? The reason I'm asking this question is because Christabel raised this, as a community, how do we respond? How do we respond? There's your job response, like the early childhood workers or the school teachers or the police. But as people in the community, how do we respond? What are your thoughts about that?
That's a very tricky question, Leanne. Goodness me. Look, I think it's hard because I know the feeling that and I suppose many of the listeners will get this, is like you see something going down in the street, and I don't know about you, I get a cold sweat and I'm like, oh, that's not good, and my heart starts to race and I'm like, oh yeah, that's not right. And I think the first thing is we really need to start to pay attention to what we feel. Like, our intuition is so important, and I think that's the first sign something's not right. And I think there's lots of different strategies that we can use, because we can start to talk about things like bystander behavior, right? Like,
yeah,
when we are a mandatory reporter, we've got an out. Okay, we have an out where we can report. Okay, so we can put something together and make a submission and say, I've done my thing, I've done what I need to do. When you're out in the community and in the public, I think it's hard. So I think, first of all, we have to trust our instinct. If something's not right, find a way to report it. And there's multiple ways to do that, through Crime Stoppers and those types of things. So I think when we start to collectively start to report things, even if we're not sure, just say, look, I'm not sure about this, but I think this is what's going on, and these are the reasons. So I guess becoming aware and having education then is really important, because when we can articulate the reasons for why we feel what we feel,
yeah,
we can justify our response. So, I really believe it's important to make sure we trust that, because you might pick up on something that is the key that police might be looking for, or that young person needs, and it might be just the missing thread that police need to put something together in order to protect a child. So I really believe in speaking out those things. If you're too afraid to approach someone, like you're talking about a situation in a shopping center, which I think is,
very public. It's very public.
Yeah. And it might be, sorry, Liam, maybe not the best example, but if I wanted to stop that behavior, I might use a distraction technique. Like, I might go and ask her or that mum a question, like, do you know where the spaghetti is? Like, just to stop that and be like, oh, are you okay? And then use it as an opportunity to have a conversation. And, you're already got that education and the ability to speak into that person's life. You can say, hey, is everything okay? Maybe she's in a domestic violence relationship. Maybe there's something going on, and you say, is there something I can do? Where you're aware, you can empower. And when you don't have that awareness, you can't. And so I think it's really important that we all have a collective responsibility towards education and understanding, and then action, and I think that there's different ways we can use that action. But I also think in that we have a responsibility, potentially even National Centre or National Office of Child Safety, but how do we report? How can we action? How can we,
What do you do?
Make
What?
organizations more aware of what's
Yeah.
going on. You know, maybe it's your neighbor, you're not sure what's going on. Because a lot of people ask me like, oh, I think this is happening, but I don't know. How do I tell? It's like, oh, okay. So I think it's really an awareness piece around what can we do to be empowered to report. Where do we report? How do we know something's happened? Because often people want to report, but then they also want to know that action's been taken and something's been done about it. So there's also that follow-up part of it where, and particularly for survivors might want to tell police about something, but not always make a report, right? And so there's a part there, even when they make a report, is like, well, what happened to that report? And so it's not leaving someone in silence, because where there's silence, there's anxiety.
Can I?
And mistrust. Yeah, sorry.
Yes, well, I'm sorry if I sidetracked the conversation with the example, but I am noting in the Q&A that there is also a question there, and I'd go to you, Daryl, on this about, do we know, initiatives in primary and secondary or even tertiary school level that educate children on what a normal family relationship is, so that they have a yardstick. And what do you think about that idea?
Yeah, absolutely. Look, there are lots of strategies and programs. I've just put a link to Good Start's educational resources, but there's lots that are aimed at different developmental periods that actually teach about, consent and respect that are appropriate to those developmental periods. I think what's important, though, is that those programs that are focused on, educators working directly with children and young people are complemented using a whole of school or a whole of centre approach, and work with the adults as well. So they need to understand, why are we using this language? Why are we talking about these concepts? So that parents are kind of brought along the journey, and both children and parents are getting exposed to what is normative, and what is okay, and what are things of concern. And it's both about actions from adults, but also actions from other children and young people or older adolescents. All of those things actually need to come into the conversation. So yes, I do think we have some great resources, but are they consistently applied? And do we have, that kind of whole of organization approach, including not only all of the educators or teachers, but the broader, kind of community, particularly parents, I think is an area that we have a long way to go. I should say too, I'm realized I've been putting a lot of stuff in the chat, and unfortunately I've been selecting host and panelists. I didn't realize that the default was that. So other people might have been doing the same. If you put some chat stuff
there's been
in,
some
we're
issues
seeing it, but nobody else is. So you just need to repost it. But
in the Q&A, put it in the Q&A. That's where that's where we'd like to see it. And look, we've only got a few minutes left, and I am, aware that this has kind of raised a lot of issues, and I just remind people to look after yourselves in this process. There has been a question here. I'll come to you, Christabel. There has been a question, a really interesting one here about, have parents ever been asked how they can be reached, like a national survey? And I'd be interested, Daryl, in your experience of that, or Kelly as a researcher. Do you know about research in that space about parents and how to access them and how to support them?
Yeah, well, certainly I can jump in there. We did a review of the ways in which parents are included in child sexual abuse prevention education in school contexts. So we've got a systematic review exactly on that topic, and I'm happy to put the link into the chat. But Kel, you might have some thoughts.
Yeah, look, I think it's hard. There is the Canadian Centre has done amazing work with some CSAM survivors, the Phoenix 11, and they did a full survey report, not only on stakeholders, but also from the parent side of things. And I think there's some really good insights in there that we can draw from for parents. But I really do believe, I mean, look, I could talk for a really long time on this, because my mother was also sexually abused. And I often talk in my podcast about that moment of my disclosure and then having her disclose, and that was the first time she disclosed in 30 years. She said, I didn't want that to happen to you because it happened to me too, right? And she hadn't told anyone. So there is an issue with parents who've also been sexually abused that don't know, may not see the flags, because they believe, or anyone really, because I think there's an issue with the normalization of abuse, and it becoming so, we do need these powerful conversations, but we're also normalizing a lot of these behaviors. And I think we need to really understand the long-term impacts of this and make it really publicly known, because I think that's where our power is going to be, because it's not intervening now, we're causing a massive, massive mental health epidemic, and massive, massive health epidemic by not intervening in this in the right way. Because these are going to be young people who become adults who don't know how to have, they won't have resilience, they won't be able to have these conversations. They're going to need long-term support. They're going to need long-term healthcare plans. This is a huge weight on our system. So it's actually more beneficial for us to focus on early intervention, is my belief. But the parent role in this, they need to be empowered to support all of this stuff and be accountable as well, because I don't believe parents are accountable. I believe they want the responsibility to lie in schools. Oh, the school will do that. The school will talk about this. The doctor will tell them about this. The doctor's got, someone else is going to teach them about sex ed. Well, no, they're not. And you're not sure that that's going to happen. You as a parent take on that responsibility when you have a child. There's certain things that need to be done to empower your child to have their own voice, because that in itself is a prevention mechanism.
And that goes back to our new phrase that we're borrowing from you, Daryl, the mandatory support, as opposed to the mandatory report. Christabel, can I ask you to just reflect on the kind of key takeouts from this conversation, and then I'll go back to the other panelists. What are the key takeouts or things that you would most like people to take away from the conversation?
Well, I'm just very grateful for an opportunity to just expressing my tiny little part of the jigsaw puzzle that we talked about. And the thing that I've gained from the discussion is that everybody is concerned and wants to do things. We don't have this dialogue between the different ways in which we address it, and maybe the different ways in which some aspects, and I take my perspective in this, can offend, or people can want to know more but feel put off by it. And could I just say, there is a question in the chat towards me. Anybody who's listening who wants to send me an email, if the National Centre can give it out, I'm really happy to answer any questions at more depth. I think the one thing I do feel, which is sad, is that we've just skimmed the surface and talked about a lot of very, very complex issues without necessarily coming to a nice, tidy conclusion. But I value the fact that we've exposed areas of unaddressed need within our community and within families, and to address this terrible scourge of child sexual abuse in a way that I have not experienced before. I haven't been able to be part of such a lovely dialogue. And so thank you to the others for what I've heard from them, and how I've had to think, how does that integrate with what I believe and what I've been doing all this time?
Yeah.
Thank you.
Thank you. It's an absolute privilege to have you, Christabel, on the panel. What about you, Daryl? What's your takeaway and the key standouts from this conversation?
Well, I suppose it's two things. Christabel's already touched on it. As I said before, I really resonated with that image of a jigsaw puzzle. So, to recognize that we all we might have a particular passion or a particular interest, or even a particular strategy when trying to solve a jigsaw puzzle, of where we might start and how we might come together, whether we, have two or three people helping all together at the same time to pull those pieces together. I think that's a really useful image. And Kel, I really resonated with the language that you were using around, basically needing to build parent capability. How do we actually support them to do their job and hold them accountable to do that? Noting, of course, that, some parents are themselves the ones who are engaging in the in the sexually abusive behaviours. Some of them are sitting by idly when they should be leaning in and asking curious questions and being a capable guardian. But to me, then, it links the child sexual abuse prevention agenda with the broader child maltreatment prevention agenda, where we know already that, you know, parenting capability is a really important thing. And it's not just about sending parents who want to do it off to a discrete program or workshop. It is actually about bringing those key messages around what does capable parenting look like into places where parents already are. So how can that early childhood worker have that, you know, sort of 2-minute interaction with a parent at drop off or pick up time? You know, how does the sports coach, when they're, you know, consoling a child who, you know, missed out on getting into the grand final, and they're handing the child back to the parent at the end of the training session, what are the interactions that they can have that support positive parenting, that support consent, respect, equality, and so forth? Minute things that make a real difference, and it's all part of the jigsaw puzzle.
Yeah, thanks, Daryl, and thank you indeed for your wisdom and sharing it with us today, because it's bringing the conversation together where the richness is, and you're always such a great contributor. Thank you. Kel, what do you think?
There's so much, and look, I agree with both Christabel and Daryl's reflections there. I really have to come back to the end-to-end support. And one thing we really haven't said, but is a real theme for the National Centre, but also coming out of the research, is the need for that support to change with the needs of the survivor over the life cycle of their engagement in any system. And I really note that couple of things. One, the grooming, we really have to pull that apart. And I really believe there has to be a far greater education around grooming and why it matters, because where we can do that, we also are going to be able to, I think that will have flow-on effects for coercively controlling relationships in domestic and family violence, which obviously is a massive issue. So where we can educate around that, I think we're going to solve some problems. But I think there has to be a massive level of accountability and a shift in our systems working together for these vulnerable families, where we're talking to each other, and then, you know, we know what's happening, that these families are supported right from the beginning. And there needs to be some, you know, I guess a national curriculum or national approach to educating kids really early to be able to have these empowered conversations and improving infrastructure and support. We must do that.
Yes, and I, you know, I can't thank you enough for sharing your story, and both as a police officer and as a victim and survivor, but also now as a researcher, and also with your own public engagement with the big community of lived experience victims and survivors. What an astonishing panel! Thank you so much for what you've put into this webinar. Let me say that the National Centre is, you know, really excited about our upcoming 2-day showcase in October, which you can still get tickets for, where we're taking this model of different knowledges together and creating 5 big conversations just like this. So we've called the showcase Reshaping the Conversation, and it is about doing exactly this, having a range of experts on some panels talking about some really big key issues, including harmful sexual behaviours, complex trauma in adults, the system issues, and particularly with the harmful sexual behaviours piece, what happens in schools and what educational settings need to be doing. So we're very excited to be bringing that to you. So there won't be one of these webinars in the next month, because we'll have those 5 panel discussions as part of our showcase, which you can also get live access to if you register through our website. There is a code there for you to complete a short survey. We provide all of the feedback from these surveys back to the panelists. So, you know, if you have messages for them, or you'd like to thank them for what they've said, that's a way to do it. And can I just also thank you very much for the engagement online, because it's in the interactive engagement that we understand what some of the issues are. I'd remind you about the support services that are there if you're still got some issues or thinking through things that you'd like to talk with someone about. And finally, can I also just thank you again to the panelists for their awesome engagement. And thank you for joining us today. It's been fantastic. So see you. We've got our Reshaping the Conversation in October, and then our November In Conversation, which is about the intersection of family violence and child sexual abuse. Thanks, everyone. See you next time.